It's my great pleasure to introduce today's speaker, Beth Wilson, who was Victoria's Health Services Commissioner from 1997 to 2012. Prior to becoming the Commissioner, Beth was the President of the Mental Health Review Board, a senior legal member of the Social Security Appeals Board and Work Care Appeals Board, and a past President of the Victorian branch of the Australian and New Zealand Association of Psychiatry, Psychology and Law. Beth is a lawyer by training with a long-standing interest in medico-legal and ethical issues. And in today's Lunchbox Soapbox, she will explore the so-called conscientious objection still found within the medical industry around the issues of abortion and birth control, and how the removal of choice can impact women's health. Thanks.
Thank you, everyone, and thank you to the Wheeler Centre for giving me the opportunity to stand on the soapbox, something I've always looked forward to. I'll begin by acknowledging the traditional custodians of the land that we're meeting on today and pay my respects to their elders, past and present. I've got 20 minutes, so I'm not allowed to muck around. We all have biases. It's therefore very important to declare at the outset what those biases are. I believe that everyone has a right to safe, effective health care. I believe women should have access to abortions where necessary and other reproductive health services in a timely and safe manner, free from harassment and discrimination. Recently, we've seen a concerted effort by some groups of health service providers seeking to limit or prohibit women's access to these services on the basis of conscience. I'll be submitting that conscience does not belong solely to people who are pro-life or anti-choice. It is also the motivating factor for those of us who believe in a woman's right to choose. Women's reproductive health services continue to be the subject of controversy and some extreme views. There are some people who regard abortion as murder, and therefore people like me, presumably, who've had abortions as murderous. On the other hand, there's a school of thought that argues that health service providers who refuse to provide abortion services and other contraceptive assistance to women are not conscientious objectors at all, but are really engaging in what they call dishonourable disobedience. While I acknowledge that conscience can lead to harassment and discrimination, I personally do accept that health service providers should not be obliged to provide services which go against their conscience, except in emergencies where it's necessary to save the life of the woman. But I also believe they should exercise their conscience in ways that do not harass or discriminate against women. So, what is this thing that we call conscience? According to the Oxford Dictionary 2008, it is the faculty or principle which pronounces upon the moral quality of one's actions or motives, approving the right and condemning the wrong. The definition doesn't actually help us very much at all because we live in a morally pluralist society, and what I decide is right, you may decide is wrong. There is thus a need to strike the correct balance between people's right to safe medical treatment and the right of health workers to their conscience. Now, the major issue in Victoria at the moment has been Section 8 of the Abortion Law Reform Act 2008. It's my contention that Section 8 does strike the correct balance. And I'll just read the exact wording to you because some opponents of abortion have tried to mislead the public by arguing that Section 8 forces doctors to refer a woman for an abortion or to participate in abortions. What the section actually says that if a woman requests a registered health practitioner to advise on a proposed abortion or to perform, direct, authorise or supervise an abortion for that woman, and the practitioner has a conscientious objection to abortion, the practitioner must A, inform the woman that the practitioner has a conscientious objection to abortion, and B, refer the woman to another registered health practitioner in the same regulated health profession who the practitioner knows does not have a conscientious objection to abortion. There's two other subsections which deal with emergency situations where the abortion is necessary to preserve the life of the pregnant woman. In that situation, doctors are obliged to perform the operation and nurses are obliged to help the doctor. But the referral sections do not mean that a general practitioner or any other health service practitioner with a conscience or a conscientious objection, it does not mean that they are referring for abortion. They are referring to another medical practitioner if it's a doctor, and what then happens is up to the doctor and to the patient. It may indeed lead to an abortion, but it may not. What's really important is that the legislation recognises the right of the woman to learn about what all her options are. And doctors who refuse to refer in accordance with the Act are breaking the law, risking their registration, and they seem to be arguing that the only point of view a woman is entitled to hear is theirs. That's a very arrogant view. When I was Health Services Commissioner, I heard many stories of health service providers, doctors in particular, but also some pharmacists and nurses, who claimed conscience but really abused it. One woman who was in her early 40s and had teenage children found herself unexpectedly pregnant. She sought assistance from a general practitioner who threatened to certify her under the Mental Health Act if she persisted in trying to get an abortion. Now that's extremely poor health care. It led to a lot of distress. It was a clear abuse of the doctor's responsibilities, all in the name of conscience, I wonder. Unfortunately, there are numerous examples of harm being done to women because some health service providers have refused to treat them claiming conscience. And Leslie Canold has documented some of these in an opinion broadcast that she did for the ABC's Religion and Ethics program in 2011. They include the suicide of a 13-year-old girl refused an abortion after being raped by her 24-year-old cousin, the death of a woman with a painful colon disease when doctors refused on moral grounds to treat her because she was 2 months pregnant, a woman who had been advised to have an abortion because of the impact of an eye disease. The abortion was refused, she went blind. Deaths also have occurred in Catholic hospitals where women were refused abortions, and who can forget the death of the young dentist in Dublin? She was refused an abortion because a faint fetal heartbeat was detected. She was not a Catholic. She was left to die anyway. Is this conscience, medical negligence, or manslaughter? Or is it all of the above? Some pharmacists also claim conscientious objection to contraception and to dispensing the so-called morning after pill. Sally Coburn has reported that a woman who sought the morning after pill was refused by a pharmacist. She became pregnant and had to have an abortion. I'm not sure how the pharmacist reconciles that outcome with his or her conscience. And I wonder how the pharmacist would have reacted if the woman proceeded with the pregnancy and sued him for child support. The obligations of pharmacists are set out by the Pharmacy Board of Australia, and they're administered by the National Registration Authority, APRA. Pharmacists who have a conscientious objection to providing oral contraceptives on moral or religious grounds should nevertheless always act professionally and ensure that consumers are informed about where else they can access these items. In February this year, the National President of the Pharmaceutical Society of Australia, Grant Kadachi, commented on a Victorian pharmacist who was asking his customers to shop elsewhere for birth control pills. And he was putting notes in packets of oral contraceptive pills indicating that he is opposed to the use of artificial contraception on religious grounds. Mr. Kadachi said that under the Pharmaceutical Society of Australia Code of Ethics, a pharmacist has the right to decline provision of care based on a conscientious objection, but this should not be allowed to prevent the consumer from accessing health care that they're entitled to. He said, therefore, in these circumstances, the pharmacist should inform the consumer of the objection and appropriately facilitate continuity of care for the consumer. There are particular difficulties, of course, in the regions. If there's only one pharmacy available, it's very difficult for women. In these circumstances, the professional associations advise the pharmacist to keep a supply of the contraceptives, to dispense them, but ask the consumer to seek help elsewhere in the future. There's a paper called Nurses and Conundrums of Conscience by Assistant Professor Carolyn Labs of Marquette University in the US, and it gives a very detailed exploration of the controversy surrounding conscientious objection and healthcare, focusing specifically on nursing. Nursing is a profession that includes much morally serious work. It's just part of the nature of the beast, as it were. But Labs argues that a misunderstanding of the meaning of conscience has been leading to a lot of distress among nurses and possibly also to a chronic shortage of nurses. The obligations of nurses who claim conscientious objection are also prescribed by the Nurses Board of Australia and administered by AHPRA. And there are other various codes of ethics by the college and professional nursing organisations. The College Code of Ethics for Nurses, in common with those other organisations, is framed by the principles and standards set out in the United Nations Universal Declaration of Human Rights. These codes of ethics, including that of the Australian Nursing Federation, recognise the right to conscience, but also instruct all nurses to behave professionally at all times and not to discriminate or harass patients who do not share their religious or moral views. I mentioned at the outset that conscience does not reside solely with opponents of abortion and or contraception. Jo Wayner mentioned on 3AW's Talking Health program that her husband, Dr. Bertram Wayner, set up the first legal clinic here in Victoria in 1966 to provide safe abortions, and he did so based on conscience. Dr. Wayner, in common with many other health workers, had witnessed the terrible, dreadful infections that women were experiencing because of unhygienic practices of the backyard abortionists, or because of self-administered or forced home methods of trying to procure the termination of an unwanted pregnancy. And I want to refer you to this excellent book by Gideon Haigh. It's called The Racket, or How Abortion Became Legal in Australia. It documents the history of Gideon, by the way, generally writes on cricket. I'm not quite sure what motivated him to write this book, but he did a great job. And in his usual romantic manner, he's dedicated this book on abortion to his fiancée, Charlotte. His book documents the history of backyards in Victoria, and it's essentially a history of what happens when a much-needed service is prohibited. And it's a history of the rogues who come out of the woodwork, and in this case the abattoirs, to capitalise on women's distress. Some of the names of the backyarders continued to feature in Victoria's gangland families. You will have heard the names Moran and Lewis. And as a young woman who required an abortion, I'm eternally grateful to Dr. Wayner, whose conscience meant that I was safe. Gideon's book ends with my personal story, and it begins with that of another young woman who was not so lucky. Carolyn Jamieson was 21. She died during what Gideon calls the last illegal abortion in Victoria. Jo Wayner has also made it clear in her research that the reason women's reproductive health attracts so much controversy is because it's really about control. Anti-choice advocates want women to remain subservient. They cannot abide the thought or the reality of women having true autonomy. And what better way of attacking and shaming us than by focusing on the sensitive area of reproductive health? I contend that in Victoria we are extremely lucky to have an Abortion Law Reform Act that carefully balances different views and allows for conscientious objection. But this should never be abused. Women in Australia still have great difficulty accessing services in the regions or where later term abortions are required. The laws between the states vary, and I would urge all jurisdictions to follow Victoria's example, but maybe to add some further restrictions on protesters harassing women at clinics. Medical abortions through medication are now also available and legal, but there are still some serious access difficulties. There's not enough general practitioners and pharmacists registered to provide the supervisory services. This could be because of conscience, but the attitudes of some of the major medical insurers have also been an obstacle. Some of them are charging the same premiums for medical termination of pregnancy as for surgical, and that's 3 times the amount for the health service provider than really should be charged. I don't know why they're doing that, whether it's based on conscience or just on economics, but it is certainly limiting women's choice. In conclusion, conscience belongs to all of us. The right to pronounce upon the moral quality of one's actions or motives, approving the right and condemning the wrong, should be available to us all. However, we should exercise conscience responsibly, without harassment, gross exaggeration, or discrimination, if we are to live together well in a society that respects individual beliefs. Thank you.
I was just wondering what sort of recourse a woman would have if she feels that she's come into contact with a conscientious objector who doesn't make it clear. Is there a legal recourse?
Yes. The woman can complain to the Health Services Commissioner and or to the, if it's a doctor, to the Medical Practitioners Board of Australia. If she makes a complaint to the Health Services Commissioner and they decide it needs to go to the medical board, they will refer it appropriately. And it'll be up to the medical board to investigate, find out what happened and take appropriate action. If they decide that it's unprofessional conduct or it's in breach of the law, they would refer it to VCAT, the Victorian Civil and Administrative Tribunal, for a hearing, and the doctor's registration could be at stake.
Any questions? We've got one over here.
I just have, I suppose, 2 related questions. Firstly, what would the implications be, particularly if a co-payment for GPs came through, that you have a situation where women are being forced to pay at minimum a co-payment fee to see a doctor who then refuses to provide them with a legal service and requires them to go and see another doctor and pay a repeat fee? Yeah. And the second thing I was wondering about was whether there's been any talk or if there's anything in place that actually supervises when people are objecting, and therefore whether there's any sort of numbers or geographical awareness of if you've got particularly bad rural areas where there are hotspots where many doctors are refusing to refer, and then they'd have to refer somebody into the city, and that patient would have to incur additional costs and delay in getting that kind of service. Okay,
thank you. What an excellent question. Let's talk about the co-payments first. I heard a doctor the other day saying, oh, it's only $7, they can afford that. Well, there's a lot of people in the regions who cannot afford at the moment to have their prescriptions filled. And this could certainly discriminate against poorer women, and as you point out, women in the regions. And what an irony if you go along to be refused and then have to pay again. I think there should be a register of conscientious objectors, because I think women have a right to know, and I think there should be a sign in the clinic that says Dr. So-and-so does not provide these services. I also think that we should have a register of Member of Parliament's views on these matters as well, so that when we exercise our democratic right to vote, we'll know who it is we are voting for. And since I'm on the soapbox and getting rather wound up, I'd just like to make it very clear that Geoffrey Shaw did not get expelled from Parliament because of his views on abortion. He was expelled from Parliament because he rorted his entitlements. Have I answered your question? The register? No. No, and I think that there ought to be.
It's just really a follow-up to that, though. Does the Health Services Commission, the reports from women who are saying, look, this doctor, refused to refer me to another health professional, is that data publicly available from the Health Services Commission? And anyway, do we know what that data is looking like at the moment?
The answer is no, because all of the Health Services Commissioner's complaints are confidential. And a lot of things that come to the attention of the Health Services Commissioner don't necessarily end up as complaints. So, for example, the little anecdote that I read you about the woman who was threatened with being put on the mental health database, I begged her to lodge a formal complaint. I would love to have investigated that doctor, but she was in a really dark place emotionally, and we just had to let it go. So I never even found out who it was, though I have my own ideas. Data around abortion is difficult because it's not a great public thing.
Thank you, Beth. That was terrific. I saw you at our Probus Club about 3 years ago. You were the most entertaining speaker I'd heard in a very, very long time. I was hoping for some more jokes today, but if you can come up with one,
it wasn't a very funny subject.
Look, I agree with everything that you've said.
Thank you.
I support women's rights to safe, legal, affordable abortion. I do wonder whether 80,000 a year is an excessive number in Australia. But have you got a comment on the activities of Kermit Gosnell in America and Peter Singer, who I think suggested that you could actually do it after birth?
Okay. Probus clubs, for those of you who don't know, are clubs that support senior citizens, and they've really helped me to age, I must say, because as I was getting older, I would go often to Probus clubs and see people helping each other, being very, very kind to each other, looking after each other and being really funny. And I thought, yeah, that's the kind of old age I want. And I did ask a gentleman at the Frankston Probus Club, what does Probus actually stand for? Oh, he said, it means professional retired old buggers useless for sex. Well, we wouldn't have an abortion problem. But his friend said, no, it means prostate removed, other bits under suspicion. As to the number of abortions, opponents predicted that once the abortion law reform came in, the numbers would skyrocket. They didn't. They've pretty much stayed the same. I don't know if that 80,000 figure is correct or not, but what it does demonstrate is there's still a very big need for the service. But maybe medical emergency contraception and MTOP, or medically terminations, could reduce the need for so many surgical abortions. And we're slowly getting on the way to that. Peter Singer's views are controversial. I haven't actually read about the afterbirth one. Does anyone else know about that? I've read some of his stuff on fetuses with problems like intellectual disability or whatever. I think we really need people like Peter Singer out there getting these ideas out into the open so that we can talk about it. And whilst I don't always agree with him, I don't agree with the people who want to shout and shut him up and not have the discussion. We need to hear everybody's viewpoints. What we need is a bit more respect and kindness as well. It's not much of an answer, but it's the best I can do.
We've got another question over there.
Thanks, Beth. That was really very interesting and informative. My question relates to the obligation to refer. Whenever I'm talking about this issue with people, the question which is constantly thrown back at me is, why is there even a need for such an obligation, given that someone can just get onto Google and find out for themselves where they can go to? And I feel like I never really have an entirely satisfactory response to that. So I'm wondering if you can share your thoughts on that.
Okay, I think when I responded to the Law Reform Commission's paper on this, I didn't actually support the conscientious objection clause because I just thought these services were a women's right, and that encouraging conscientious objection would also encourage abuse of it. However, it is there now and it's working well, and I do support it. As to just saying, well, go to Google, that's kind of interesting coming from health professionals who generally are complaining that people are going on the internet and finding out about medical services instead of listening to them. And not all of us are able to find our way around that. I think a lot of young women don't even know much about this controversy or argument. They just think, if I need this service, it's my right. I'll go and get it. But it's hard to find your way around medical processes, and there are a lot of young women in the countryside who've got little babies that they had not planned but were unable to access services. So the clause is needed. You can only just try and put a sensible point of view to those people.
Question here?
Yes, Beth. One side of the page is, the conscientious objectors, and the other side they never seem to consider are the children that are babies that are born, the unwanted ones, the abused children, which is all tied in with each other. Is there any follow-up, or is there anything that's connected in the way?
Well, wouldn't it be lovely if all children who were born were planned, wanted, well, in families that were able to look after them? But the reality of the society that we're living in at the moment, we've got an absolute epidemic of drug abuse. ICE is really, really, really scary. High moral ground arguments very often ignore the reality on the ground of what people's lives are actually like. If you're a child of abuse or drug and alcohol affected parents and the cycle goes on, I don't think just aborting babies is going to be the answer to all of those social problems, but they do tie in. And what we should be working towards is a situation where women do have autonomy and where they can make a full choice, and, ideally that every child that's born is wanted.
Spontaneous conception seems to be a bit of a design fault.
A design fault? Well, I think it's probably more likely that the condom broke.
Got another question on the other side?
Thank you so much. You managed to pack so much into 20 minutes. It's
Thank
amazing. Lots of food for thought there. My question is actually around emergency contraception, or the morning after pill, which is the only method that can work after sex. And I'm just wondering, firstly, on what grounds could a pharmacist oppose or prevent a woman from accessing that? And I'm also wondering, in those areas where it's hard to access EC, whether advanced provision could potentially be a way around that for women to ensure that they're protected, if you like.
Pharmacists should not be refusing to supply emergency contraception. And if they're not going to supply it themselves, they should be referring the woman to somewhere else where she can get it. But that's got to be accessible. In the cases that I mentioned, these things don't actually generally happen at 10 o'clock in the morning, well, depending on your preferences, I suppose, but it's generally more likely to be late at night when there are not a lot of services around. And I think pharmacists need to be cognizant of the special difficulties that women are in that situation. But some of them are taking the high moral ground and refusing to supply. If anyone knows of that happening, that should be immediately referred to the Pharmacy Board of Australia for investigation.
Thank you. Before the Law Reform Act came about in 2008, there was a huge amount of research, collaboration, discussion among women's groups in particular, but also with people involved in the medical area, so that we thought we had come up with something that was pretty much foolproof and acceptable to all. Why do you think, are we just doomed to have people who oppose women's reproductive rights popping up every now and again and reinventing that whole argument of conscience as they see it? or is there something happening at the moment that was sort of spearheaded by Jeff Shaw but seems to also be evident in who gets pre-selection in the Liberal Party, for example, at the moment?
Yeah, that's a big question. There was extensive consultation, you're right, and there was bipartisan support for the abortion law reform bill, as it then was. I was in Parliament for most of the debate. It was high drama. It was really, really fascinating. And frankly, the antics of some of the antis did not make them look very good at all, screaming, "There will be repercussions, you've got blood on your hands, Brumby." And actually, I was trying to get my seat when that young man got up and yelled that out. And Sally Coburn called me that night and said, "Beth, I saw you on the telly, you looked really scared." I said, "Well, not half as scared as I would have looked if I'd known the camera was on me." But look, I think if I'm right with my data, I think it's 85% of people fully support a woman's right to abortion. I may be wrong on that figure, but it's a very high number. It's a small minority who use this issue to get a lot of media attention, and that's certainly happening with Mr. Shaw at the moment. And I've tried to explore those reasons in the address that I've just given, and I really do think it's about they want to keep us down. They just, for some, it's just intolerable to them to think that women lock them out and say, "This is our choice, mate, not yours." I mean, again, ideally, a woman and her partner would be involved in discussions with the doctor in making these decisions, but we don't always live in an ideal world. I think that in planning our tactics, if we support women's rights, and we must never ever sink to the level of the other side and be abusive, discriminate, and just hurl names. We've got to be a bit more clever than that. That's a real flimsy kind of response, but it's about the best I can do, and I think you've been campaigning longer than I have.
Unfortunately, we've run over time, so I know there have been a lot of questions. But
I'm happy to stay behind and answer your question.
Thanks, Beth. That would be fantastic.
Okay.
Thank you all so much for coming, and please join me in thanking Beth for a fascinating talk.
Thank you.